Hi, James. I just wanted to give you some information to help you be more aware if this should happen again, of what to do and where to go. I'm here to try and answer some of those burning questions that you may have at this time, okay? So I'm just going to go over some frequently asked questions and some information that could be helpful with managing sickle cell disease and preventing sickle cell crisis and things like that, okay? So for emergent situations like when to call 911, if something should happen, you definitely want to know your symptoms of stroke. So the easy way to remember that is an acronym called FAST. That is for F is for facial drooping. So it'll be like half of your face is kind of drooping and you might feel some numbness. Um, so F is facial drooping, A is arm weakness, and S is speech difficulty, and T is time. So usually a stroke will affect the left or the right side. So this can be like one arm, like if you're trying to lift both arms, only one will lift up, or the other one will pretty much stay down, kind of limp. So if you start experiencing these kind of symptoms, you need to look at the time on the clock because that's going to be vital for your healthcare provider to know whenever you get to the hospital, okay? Um, so when to seek immediate care, like, so that's just the difference of someone taking you versus you taking yourself. So for when to call 911, you definitely want to do stroke symptoms like sudden vision change, difficulty walking, or extreme headaches. You definitely want to call 911 because you probably aren't going to be able to drive, um, because sickle cell does put you at a higher risk to have a stroke. Um, so when we're seeking immediate care, going to the emergency room or the urgent care and things like that, you're going to want to go look at your swelling of your skin, see if that's changed. And usually that's going to be within your hands and feet. That's usually the first signs of sickle cell. It's accompanied with fever, generally, because that's also a sign of infection. So you can have intense pain. Whenever you do have intense pain, be sure to go to the emergency room where they can manage your pain and to treat the underlying cause of said pain. You may have painful erection of the penis. This can last under 2 hours or more than 4. But when this starts, you need to urgently get medical attention. Discoloration of the skin, whether it be pale or yellow. So for pale, that can be like a blockage is happening and you might have the blood's not getting to your extremities. And we need to remedy the said situation very soon. But if you have yellow skin, that can be jaundice. There might be yellow in the whites of your eyes right here. So go ahead and, be mindful of that. Just get comfortable with assessing your skin. So looking at the color, looking at, how swollen it is from day to day, or hopefully not, but just keep a track of that, okay? Next thing to call your healthcare provider about, I would recommend if you find that your pain is not being managed well, you might want to go and talk to them about pain management and things you've been experiencing, along with possible vision changes that you may have. So the medication that we're going to let you leave with us today is acetaminophen, also known as Tylenol. You can get it over the counter at your local store. It's to help reduce your pain. The side effects are rash, urticaria, so that's like hives, maybe you showed an allergic reaction, something of that nature. Stevens-Johnson syndrome, now this can be life-threatening, so just keep that in mind. At first it's flu-like symptoms, and then it progresses to a rash, into like a purple color, and then it'll have blisters. So we need to remedy that situation if that should occur. But again, these are side effects. That does not mean they will happen. That just means that these could happen. It's things to watch out for. It can also have hepatotoxicity, which is a chemical-driven damage to the liver. So just keep that in mind. So since you do have sickle cell disease, you are more prone to infections. So things like fever, swelling, redness, warmth of the skin, things like that, just be aware of, watch out for. That also goes with your skin assessment. Just looking at your skin, getting comfortable with looking at that day to day, especially your extremities. So to avoid this, make sure you're washing your hands as always. So just wash your hands and don't try and spread to others, and try and keep away from others who are sick. Um, Also receive your vaccinations when they are due. This will give you an immunity to other possible exposures that you may have. So to prevent pain crisis like we've been having, here this hospital visit, avoid extreme temperatures like you're hot and you're cold. Avoid high altitudes, whether that be travel or where you're living or your vacation situation, anything like that. Just make sure that you are somewhere where it is normal altitude for you, and also do not go to areas that have low O2, because you have a lack of blood cells that are able to carry oxygen. So it's important for you to be in well oxygenated areas, okay? Be sure to drink lots of water, and that'll help you with the infection to prevent that. I mean, the pain to prevent the pain. So I believe that's all that I have. Are there any questions that you may have for me? No? Okay. Well, thank you.